Assalamu alaikum. This lecture is the anatomical lecture for the large intestine. The large intestine will extend from the iliocecal junction, beginning the commencement of the cecum, and including until the rectum and anal canal. Rectum and anal canal also is included within the large intestine. It consists of several parts. The cecum is the commencement, blind sac pouch, and then we have the ascending colon, right colic flexure, transverse colon, left colic flexure, descending colon, the sigmoid colon, rectum, and the anal canal. Each part of it will be discussed, its length. The total length of the large intestine is 1.5 meters. But if we come to the length of each part, for example, the cecum is 6 centimeters, the ascending colon is 12.5, the transverse colon is 50 centimeters, the descending colon is 25 centimeters, the sigmoid colon is 37.5. And then we have the rectum and the anal canal. The anal canal at the end is 3.8 centimeters. These are the lengths of each part of it. If we come to, in general, illustrate the difference between the large intestine and the small intestine, in addition to its position, position within the abdominopelvic regions, also there we can say that the large intestine, mostly of it is fixed, while some parts of it will be covered by the folds of the peritoneum. The fixed part to the posterior abdominal wall is covered by peritoneum only anteriorly. The other 3 parts we can say that are mobile is the vermiform appendix, and the appendix is within the parts of the large intestine which is attached to the cecum, and we will discuss it a little further as an individual, very important structure to be mentioned clinically. So we have the appendix is covered by peritoneum, having its own fold of peritoneum, also called the mesoappendix. We have the transverse colon is covered by peritoneum, having its own fold of peritoneum called the transverse mesocolon, and also the sigmoid. The sigmoid part also has its own fold of peritoneum called the sigmoid mesocolon. Other difference, as we can see from its appearance, we can find that it is sacculated, having haustration. This is due to the outer longitudinal coat of muscular coat of the large intestine is united into ribbon-like structure, forming 3 ribbons called the tinea coli. The tonic fact of this coat will lead to haustration. It will be sacculated as this as shown. يعني هو هذا فرق عن ال small intestine إنه يكون wider in caliber and having a sacculation. التينيا كولاي بدنا نرجع عليها شوية نوضحها. التينيا كولاي anatomically consists of 3 ribbons. فراح يصير باعتبار كل part of the large intestine has its own position. فالتينيا كولاي also will differ in its position. يعني بالascending والdescending مثلا والsigmoid والcecum it will be divided. يعني تسميتها راح تتسمى anterior و posterior-medial, posterior-lateral. While because the transverse colon is set in a transverse way, التسمية مالتها راح تصير superior, inferior and posterior. Not very important to be distinguished. يعني احنا ما نجي على كل fold ونقول هل هذا superior هل هذا inferior, but it's a fact you should know. يعني ترى لأن حتى لها تسميات ببعض التكست بوكس يسميها تينيا ليبرا اللي هي الانتيريور، وتينيا اومنتالس وتينيا ميزنتالس، ترى ينطيها هيك تسميات، خاف تمر عليك وتقول هذه شنو، حبيت اوضح لك اياها بهالطريقه. بس انا بالنسبه لي اريدك تعرف انه تينيا كولاي 3 ribbon responsible for the hydration circulation, anterior, posterior, medial, posterior, lateral in some parts, superior, inferior, and posterior in the transverse colon and also in the sigmoid colon. يكون الارrangement مالته بهالشكل هذا. Also, we can find one of the characteristic feature anatomically that we can distinguish the large intestine from the small intestine. We can find small pockets of peritoneum. يعني peritoneum who covers it anteriorly. There are small pockets from the outer layer of it filled with fat is distributed on the surface of the large intestine called appendices epiploica. Okay, and it is distributed in all the parts, but we can find it, we will find it heavily at the sigmoid colon. ممكن إنه نلقاه. We will not find it at the part of the cecum and the appendix. هنا it will not be present. Okay, التينيا كولاي, the commencement of it, إذا نريد نفهم البداية مالته, starts from the base of the appendix. يعني من تيجي هيك كأنما شوف شلون جاية كأنما هذه بدايتها، بس هي commencement مالته will start from the base of the appendix. And if you ask where does it ends, it ends at the lateral, at the lower half of the sigmoid colon, where it will be continued with the outer longitudinal coat of the rectum. يصير عاد ويا layer of the rectum. هذه بدايتها ونهايتها. طبعا each part also when we will come it will be in a single or can take more than 1 to 2 abdominopelvic regions. Position also in the abdomen we should be aware about. If we come to talk about each part of it, now we will start with its beginning, which is the cecum. هذه طبعا الصورة حبيت أوضح إنه هاي الأبندسز epiploica أو epiploic appendices, other term of it, هاي الهاوستريشن الموجودة. This is the tinea كولاي. بالداخل هذه الفولدز اللي نشوفها احنا قلنا بليكا البليكا سيركولاريس هنا مختفية، فهاي ترى مو البليكا، هذه due to the haustration اللي موجودة of the large intestine. Now let us discuss the cecum. The cecum is the beginning of the large intestine, and we said its length is 6 centimeter. Its width is 7.5. So it is one of the organs that the width is more than its length. Okay, احنا متعودين أغلبية الأورجنز نذكر اللينث والويدث والثيكنس، هذه الأناتومي، ومتعودين إنه أغلبيتها الطول أكثر من العرض، لكن هنا the cecum is one of the organs in our body that its width is more than its length, in addition to 3 other organs. خلينا نعطيك إياها اللي هي حتى ما تنساها نرمز لها ب 3P يعني 3 بيات، اللي هي البروستات والبونز والبيتيوتري. فصار عندك the cecum, the prostate, the pons, and the pituitary are the organs in our body that its width is more than the length. The cecum occupies the right iliac fossa in the abdominopelvic region, just above the lateral half of the inguinal ligament. Okay, if we طبعا it is a blind sac, it appears as a blind sac. It has 3 connections. إذا نيجي عليه, it has a connection above with the ascending colon through the Cecum-Colic junction. It has a connection with the ileum through the iliocecal junction also. And just below the iliocecal valve, طبعا guarded هذا junction by a valve, just below at 2 centimeter, we will find its connection with the appendix, with the vermiform appendix. Okay. Also, if we come to the ileocecal valve, طبعا ileocecal والbase of the appendix, both of them connect to the cecum posterior medially connection. If we come to the ileocecal valve, it is an anatomical valve. It has two lips. It has the horizontal lip اللي هو the main, or it has the lower one which is concave and connected. يعني هذه the two lips are then connected together by frenulum. Frenulum راح يصير عنده right and left frenulum. مو كل شيء أيضا لكم ندقق عليها، بس أريد the ileocecal valve with two lips and two frenula. Posterior medial to the cecum is present. It is very important, responsible for controlling the amount of the food, digested food, to be transformed from the ileum to the colon. يعني يتحكم، وأيضا طبعا يتحكم هذا by autonomic fibers, closure of the valve or opening, relaxation of the valve by the autonomic, also due to a mechanical effect اللي هو when the cecum is distended, filled with the mass of the food, mechanically it will close the valve or prevent the regurg. يمنع رجوع الطعام إلى الإليم مرة أخرى. So this valve is important. Just 2 centimeters below it, we will have the base of the appendix, of the vermiform appendix. Okay? إذا نيجي على vermiform appendix بما أنه ذكرنا, it is a worm-like structure, diverticulum. It is blinded, يعني مسدود، نهايته تكون مسدودة. الطول مالته, length is about 2 to 20. يعني من 2 سنتيمتر إلى 20 سنتيمتر ممكن إنه نلقي الفيرميفورم appendix. يقول الأفريج أو المين is 9 سنتيمتر. It has a lumen inside. This lumen is 5 millimeter الويدث مالته بالداخل, but this lumen is closed after mid-adult life. لذلك أنت طبعاً appendix is heavily endowed with the lymphoid follicles, and because of the presence of this small narrow lumen, sometimes some of the fecalith material يعني من ينحصر به مادة ممكن يصير به inflammation and infection leading to appendicitis, أو due to the يتحفز lymphoid follicles أيضاً ممكن ينطيني condition of inflammation causing appendicitis. لأنه هذا راح ينسد بعد الميد أدلت لايف. لذلك إحنا من النادر نلقي التهاب الزائدة الدودية عند الأعمار الكبيرة، دائما نلقاها بالتينيج عند بداية الأدلت لايف. ممكن يعني بما أنه هو من الأورجنز اللي بعدين الفوليكلز تضمحل شوية تقل واللومن أصلا ينسد، فما راح تصير بيه بعد مشاكل الانفكشن. Also important to know that the position, يعني هسه احنا ندليناه 2 سنتيمتر البيس مال appendix to the ileocecal valve, but the position, how does it lie in our body? خلينا نشوف بالكتاب هنا اكو صورة. يعني when we come to its position in the body, it differs. The position of the vermiform appendix differs from one person in another. Either it will be retrocolic, يعني we will find it بالضبط شلون هسه الليزر هذا البين دا أشر عليه, we will find it behind the cecum. This is هذا البوزيشن retrocolic is in 65% of its position. هذا النورمال ترى. The other position هو هذا اللي بوضح لكم هنا اللي هو the pelvic position نسميه لأنه باتجاه البلفس. This is about 30%. تقريبا. بقية البوزيشنات اللي هو طبعا مثلا يكون pre-ilial قدام الإليم, post-ilial يعني behind the ilium, ممكن يكون بهالشكل هذا مستعرض يسموه paracolic position. البوزيشن of the appendix إذا فتحت التكست بوك راح تلقيه مرات حتى منطي يعني مثل عقارب الساعة ينطي الأرقام, يعني اللي راح يكون باراكوليك يقول 11 o'clock, هنا راح يكون يقول ممكن إنه يكون 12 o'clock، هنا يقول ممكن 3 o'clock. هذه يعني في التسميات clinically موجودة. بس for you I want you to know the retrocolic position is the common position. Then the pelvic position number 2 is the common position number 2. We have in addition قلنا هذا 65 هذا بال30، بينما الأخرى اللي هي 2 3% 4% تتوزع عليها بقية النسب تكون pre-ileal, post-ileal and paracolic position. Okay, طبعا its removal after infection, its removal will be by a surgical operation called appendicectomy. It has importance to be known that a referred pain of the appendix يعني ببداية التهابه it will give a refer pain. It start of the pain will be at the umbilicus لأنه it shares the same sympathetic level. يعني ال vermiform appendix is supplied by T9 and T10 اللي هو نفس الدرماتوم اللي راح تلقاه surrounding the umbilicus. فلذلك the first sign of pain will be طبعا منو همينه ينطي referred pain to the umbilicus ترى the testis in male and the small intestine. أيضا ممكن إنه first referred pain will be at this region. هذه important to be known. Then لأنه يصير more endowed inflammation فيصير more peritoneal involvement فراح يصير restricted the pain to the right iliac fossa وبعدين يصير rebound tenderness is clinical sign of appendicitis. فهذه important to be known. طبعا إذا نجي على nerve supply of the large intestine كwhole يعني إذا نجي عليه the whole nerve supply of the large intestine, we all know it is by the autonomic nervous system, parasympathetic and sympathetic. But we have an information, you know very well, that the large intestine is the junction between the midgut and the hindgut. Where is this junction? هنا راح يصير. The junction of the right 2/3 of the transverse colon with the left 1/3 of the transverse colon. هنا يكون نهاية الميدجت بداية الهندجت. فالميدجت يعني اللي هو part of it راح يكون السيكم والأبندكس والascending colon والرايت colic flexure والرايت 2/3 of the transverse colon is supplied by the sympathetic fibers من T11 من T10 إلى L1 راح يكون from the celiac plexus and from the superior mesenteric plexus, and the parasympathetic is from the vagus. Okay, while the region of the hindgut اللي هو the lateral 1/3 of the transverse colon with the left colic flexure, descending colon, sigmoid, rectum and part of the anal canal, this will be supplied by the sympathetic fibers اللي هي reaching up to L2 from the superior hypogastric plexus راح يكون, and also the parasympathetic is from the pelvic symplanchnic nerves اللي هو S2 3 4 اللي هو راح نسميه nervus erigentis. Okay, so this is important. But the function of sympathetic and parasympathetic is both. يعني known اللي هو the sympathetic is for relaxation of the bowel and for motor vaso to the vessels, vasomotor وmotor to the sphincters that are present. والparasympathetic راح يكون motor to the bowel يعني for digestion and inhibitory to the sphincters which are present. Also عندك a region of the midgut, the pain اللي ممكن إنه يصير is usually transformed by the sympathetic part, while in the hindgut the pain is usually transformed by both sympathetic and parasympathetic. هذه أيضا معلومة ممكن إنه تحصل عليها from the textbooks ووضحنا لك إياها. هذا in general قلنا بالنسبة إلى النيرف سبلاي. بالنسبة إلى البلد سبلاي also مدام جينا يعني خلينا نذكرها بالكامل إنه the blood supply, arterial supply of the large intestine أيضا لأنه عندي mid-gut and hind-gut it is both supplied by the mid-gut من الceliac superior mesenteric والhind-gut by the inferior mesenteric. Okay, فمن نجي إلى region of the mid-gut of the large intestine is supplied by the superior mesenteric. The superior mesenteric branches to the large intestine هو راح يكون Iliocolic artery, right colic artery هذا الفوق وmiddle colic artery. اوكي فصار عندنا الإليوكوليك جوا وmiddle colic ورايت colic artery. These arteries شوف will reach near to the large intestine. It will form this loop artery called the marginal artery. فشي يقول لك large intestine is supplied by the marginal artery حتى يسموه artery of Dormond هيك شيء بس انت حفظه the marginal artery فعلى طول large intestine you will find the marginal artery. فالmarginal artery هو unite of several branches from the superior mesenteric and the inferior mesenteric. من marginal artery اللي هو يعني كأنما الحولي أو الحلقي اللي راح يكون nearby the border of the large intestine من عندها راح تطلع هذه الفيزلز اللي راح نسميها فازا لونجا وفازا بريفيا. اوكي فأنت احفظ إنه these vaza from the marginal artery will reach to the surface of the large intestine and penetrate the muscular coat of it. تمام؟ Okay. When it penetrates the large intestine, it will cause, in addition طبعاً to the presence of the appendices epiploica أيضاً, it will cause weak points in the large intestine. Sometimes these weak points will be herniated, leading to a condition called diverticulosis, one of the clinical conditions common to occur in the colon. ترى الكولون من الأمراض الشائعة اللي ممكن تكون موجودة ب CA يعني CA من يصير بالintestine usually the colon is affected and also diverticulosis أيضا واحد من common pathological condition that could affect the colon. Also عندنا dysentery. الديزنتري يعني اللي هو عادة يكون مصاحب ب diarrhea with blood يكون بينما ال small intestine more pathological clinical condition could occur هي التايفويد diarrhea in the small intestine. Clinically you should know طبعا colonoscopy is one of the أيضا common investigation tools that could be done to the large intestine. This is some points clinical you should know يعني about from this يعني كبداية تعرف الفرق بهذه الأمور. فنرجع على ال blood supply as we said from mid-gut it will be supplied by the superior mesenteric مثل ما قلت ال Iliocolic, middle colic and the right colic وال Iliocolic will send to the cecum, cecal branches ومن ال cecal branches anterior and posterior branch راح يطلع لي the appendicular artery. appendicular artery اللي راح يكون بالضبط على البوردر of the appendix من الappendicular mesocolon هو اللي يدلي الطريق و it is an end artery يعني من يوصل إلى التب يخلص كارتري موجود يعتبر. فأيضا sometimes when it will be occluded, gangrene أو something can leads to appendicitis راح يصير. بينما the hind gut will be supplied by the branches from the inferior mesenteric artery اللي هو راح يكون the left colic artery and the sigmoid artery. The continuation of the inferior mesenteric is called the superior rectal artery, which reaches to the rectum and it is the main blood supply to the rectum. And reaching طبعا rectum, region of the rectum and the anal canal. The continuation of the inferior mesenteric ترى اسمه superior rectal artery. من الانفيرير mesenteric عندي left colic artery and the sigmoidal artery. من reaching to the border also will give me the marginal artery. ومن المارجنال أيضا راح يطلع عندي الفازا longa, vasa brevia, ونفس الشيء will penetrate into the muscular cord of the large intestine. The venous drainage راح يكون بنفس الفينات، يعني بنفس التسميات، نفس الفينات. Ultimately it will be drained into the portal vein. يعني آخر شيء وهي superior mesenteric و inferior mesenteric إلى أن reaching to the portal system. This is regarding the blood supply. If we come to the lymphatic drainage of the large intestine, we pay a little attention to it. لأن مثل ما قلنا CA of the intestine occurs in the CA colon, which is one of the sites of distribution of the cancer to the body. هي lymphatic drainage. There will be sets of lymph nodes in the large intestine. يا أما أكيد عندي صورة موجودة. يا أما تكون بالبداية يعني نلقاها فراح نسميها epicolic أو you will find it on the sides راح نسميها paracolic. هاي الحمراء paracolic set of lymph nodes، أو قدامها راح تسميها epicolic. Then you have what follows the blood vessels راح نسميها intermediate lymph nodes، and what reaches to the main اللي هي to the superior mesenteric، داير مدار superior mesenteric والinferior mesenteric راح نسميها the terminal lymph nodes. فصار عندي epicolic in front of it, paracolic on each side, intermediate within the branches, and the terminal set of lymph nodes. Why is this important? Because when they come to surgical operation removing parts of the colon due to cancer, they remove these sets. يعني they remove the sometimes the intermediate and paracolic, they remove the set of the terminal according طبعا to the degree of pathology. These sets should be known، يعني تعرف epicolic, paracolic, intermediate and terminal sets of the lymph node of the large intestine. هذه هنا هي اللي ردت أوضحها إنه شوف ال entrance of the vascular will lead to weak points and sometimes herniation of the mucosal layer to the outside as diverticulum يكون بهالشكل هذا causing diverticulitis. يعني when it is inflamed يصير diverticulitis. By colonoscopy, this is a normal view of a normal colon lining, while in diverticulosis, you will find it like pockets like this. This is a view. This is the iliocecal valve. This is the orifice of the base of the appendix. هذه هنا iliocolic artery. Giving the يعني end مالته will give the cecal artery dividing into posterior and anterior branch. وترى appendicular artery usually arises from the posterior branch of the cecal artery. It is an end artery. شوفوا طبعا هذا fold of the peritoneum. من نقول كلمة meso يعني the peritoneum of the large intestine. احنا قلنا mesentery peritoneum of the small intestine. Omentum peritoneum of the stomach. فهنا meso، كلمة meso هي الfold of peritoneum. نقول meso appendix يعني the fold of peritoneum of the appendix. Meso transverse mesocolon, fold peritoneum of the transverse colon. Sigmoid mesocolon is the peritoneal fold of the sigmoid colon. والبقية rest is fixed. The parts fixed, covered by peritoneum only anteriorly. تمام. This is the appendix and its position أيضا وضحناه. This is important يعني to be known clinically. The base of appendix on the surface anatomy, how can we determine it? We know very well that we have the transtubercular plane اللي هو the lower horizontal plane drawn on the abdomen to divide it into 9 abdominopelvic regions with the junction of the lateral plane, right lateral plane, the junction of it 2 centimeters below it will represent the point where the base of the appendix is present. Okay, هذه نقطة. نجي هنا, we have, if we draw a line between the anterior superior iliac spine and the umbilicus, the junction of the lateral 1/3 and the medial 2/3 of it, this is called the McBurney's point. McBurney's point. Okay, اللي هو the point where يعني the exact point اللي هي where the position of the appendix can be present. وهي هاي النقطة اللي نضغط عليها ورأسا نرفع ايدينا فراح يصير فد rebound tenderness positive رأسا يعيط المريض. واصلا هو منطينا history of dyspepsia ومنطينا history of vomiting ومنطينا history of pain started at the umbilical region then shifted to the right iliac fossa. فرأسا ونباوع على age مالته fever يكون رأسا we give a diagnosis of appendicitis and send for the surgical award. Okay, فهذه important clinically. لازم تعرف شنو McBurney's point ولازم تعرف how surface anatomy how to point to the base of the appendix. هذه أيضا other يعني هاي on surface anatomy بالضبط هنا. هذه هنا موجود. Okay, زين. When we come to the ascending high regarding the cecum and the appendix, if we come to the ascending colon, the ascending colon قلنا it is يعني fixed part covered only by peritoneum anteriorly. If we come to the relations posteriorly راح تلقي ترى السوس والquadratus lumborum أيضا موجودة. The right colic flexure here, a right colic flexure is present at the level of L2 vertebrae and it will leave an impression on the inferior surface of the right lobe of the liver. أيضا. Then we have the transverse colon is مثل ما قلنا 50 سنتيمتر نص متر تقريبا و it will extend from the right colic flexure hanging down to the left colic flexure. It is hanged, okay, يكون شوية متدندل وحتى it reaches sometimes to the level of the umbilicus. It has a fold of peritoneum called the transverse mesocolon. Important to know that it has a relation anteriorly to the greater omentum. Posteriorly, the transverse mesocolon will give attachment to the anterior surface of the pancreas. Okay, then the left colic flexure will be at the level of T12. It is slightly higher than the right colic flexure. And it will be attached to the 11th rib at the mid-axillary line through a fold of peritoneum called the Phrenicocolic Ligament. This is importantly إنه أولاً it supports the spleen above. ثانياً it will represent the upper limit of the paracolic gutter. The gutter هو one of the spaces that surrounds the large intestine مثل الخندق يكون موجود. فبال-left side I will have an upper limit to this خندق للparacolic gutter by the Phrenicocolic ligament. هذا الشيء ما موجود on the right side. This is also important clinically if there is any abscess and the patient is in supine position دائما يعني مبطوح bedridden يكون موجود. فthere هنا extent of the fluid أو extent of the abscess نشوفه to the Phrenicocolic ligament ويوقف. There will be not extend furthermore. فيعتبر limit لهالمكان هذا. بينما here no, it can extend to other pouches and other spaces present within the peritoneal cavity. This is important also clinically. فأرجع أقول in the left colic flexure, it has an attachment through the Phrenicocolic ligament to the 11th rib at the mid-axillary line. Okay, then طبعا descend downward as the descending colon. قلنا الطول مالته 25 سنتيمتر تقريبا, considered as also one of the fixed parts covered only by peritoneum anteriorly, also has a posterior relation to the quadratus lumborum, to the من تنزل هيجي لي جوا. طبعا هنا السيكم ترى عنده posterior relation to the lateral cutaneous nerve of the thigh والgenitofemoral nerve. فلذلك sometimes when يصير problem in the cecum could يعني trigger these nerves فيصير عندنا pain of flexion of the hip, of pain of extension of the hip. أيضا يعني clinically نقدر نربط هيك شيء. descending colon when it reaches to the pelvic brim يعني enters, it reaches to the iliac crest وبعدين descending down when it reaches the pelvic brim البرم الحلقة الجوة الموجودة راح يصير تسمى بسيجمويد colon. راح يسمى sigmoid colon. The sigmoid colon will extend downward until reaching S3. من reaching S3 راح يكون عندنا the rectum موجود. Okay, the rectum. وبعدين the anal canal is the last part. The sigmoid colon covered by a fold of peritoneum called the sigmoid mesocolon. This is تقريبا يعني about everything about the large intestine. In a lecture separated we will talk about the rectum and the anal canal. Thank you very much.